welcome, Kingdom family and guests. I'm glad you could join us today. My name is Jelani Kerr. I'm with Life Development Corporation. We are a nonprofit organization dedicated to promoting health, education, and improving quality of life, especially for those in the community who have been underserved. So, for those of you who don't know, we have been engaged in a variety of initiatives to accomplish these aims, whether it's providing care and support for people living with HIV, raising awareness about mental health, providing schoolwork help or non-traditional instruction for students during the pandemic, or just plain feeding the housing insecure. We are interested in pointing people to resources that can help individuals in our community, which is why we are here today. So I'm speaking with Sameera Jackson of Wellcare of Kentucky, and she's going to provide some great information to us today. How you doing, Sameera?
I'm good. Good morning. Thank you for inviting me to share some information today.
Okay, and thanks for coming. Okay,
Of
so
course.
so let me tell you a little bit about her. Okay, so she has been a supervisor for the community engagement program of Wellcare of Kentucky for over 3 years. This program works to cultivate relationships with community-based organizations throughout the state. She's overseen partnerships and across the state that highlight how social service gaps can be filled to improve the self-sufficiency of community members. Now, prior to working in healthcare, Samira learned of the needs of the individual along with community as an in-home therapist and case manager. I mean, and as I said, she works for WellCare. So some of you may be asking, well, what is WellCare? WellCare of Kentucky is they're an organization that provides government-sponsored managed care services to families, children, seniors, and individuals with complex needs, primarily through Medicaid, Medicare Advantage, and Medicare prescription drug plans across the state. Um, so I've seen Sameera and the WellCare team out and about, partnering with churches, community agencies to really help make a difference in health for the people in Louisville. So I'm glad she's here today to talk a little bit about what she does. All right. So I gave a brief introduction about WellCare, but can you tell us a little more about it? Tell us a little bit more about the ins and outs of this.
Of course. So, as Jelani just stated, WellCare is a managed care organization. So, what that means essentially is that we provide healthcare coverage to those that qualify either for Medicaid or Medicare. So, Medicaid is designed for individuals of any age with limited income, while Medicare is for clients that are age 65 or older, or for younger people that have disabilities. And we're just like any other health insurance company. We offer benefits such as, vision, assistance for pregnant moms, a nurse hotline, Fitbit, Weight Watchers. We do the typical things, but we go beyond that in that we're looking at our individuals as a whole. We all know that healthcare is not just your heart issues or your kidney issues. There's things beyond that that affect our health, such as, if you don't have employment, that's obviously going to affect your mental health, your ability to do things. So we provide other services such as criminal expungement, assistance with scholarships, assistance with Boys and Girl Scouts, assistance for families that need physicals for their kids. Those are just some of the extra things that we do to try to help shore up our clients, along with things like over-the-counter benefits, access to Fitbit, so that they can improve their health. But more importantly, my department does something called, my department, as Jelani said, is community engagement. So what we do is we try to figure out where are the needs in our community. We specifically try to work in underserved areas and areas where there aren't just putting on a health fair, just providing clients and the community with resources that are in their area. Right now we all know that COVID is a huge issue. So what we've been doing a lot of is not only partnering with agencies that are, having COVID clinics, we're actually developing them ourselves. So for example, 2 weeks ago, I actually put on a COVID clinic at Iroquois Park. And the whole purpose of that was to reach out to our immigrant population. because, there could be language issues and barriers for them accessing their healthcare. And what better way to help folks by literally bringing it into their backyard? And so, I had interpreters set up so that our clientele felt comfortable. So that's one of the many ways that we try to provide health outreach in the community. And, I feel like what makes us stand out is we look at something called social determinants of health. So essentially that's what happens to your health besides going to the doctor's office. As I stated before, Wellcare provides services to a lot of clients that have a limited income. So what does that mean? That basically means that, a lot of our families are just focused on their basic needs. And if that's the issue, they're not going to really worry about going to the doctor's office. If the need is, my rent might be cut off, or how am I going to pay for my groceries this month? So as this graphic here shows, our healthcare is not just, our actual health and access to care. As you can see by this graph, it's only about 20%. There are a lot of factors that impact our health, such as education, income, how our community is, are there social supports, the physical environment itself of a community, meaning like if you live in an old home, there might be lead exposure. Another thing is just healthy behaviors. Do you have access to, healthy foods? Do you have access to exercise options? Things like that. So as this graph shows, as you can see, 20% of our healthcare is just about access to services. The rest is the other things that are going on outside of the doctor's office. And that's where we come in. So with community engagement, we have field staff that cover the entire state. They cover all 120 counties. I'm located here in Jefferson County. And so what we do is we try to learn about, every single grassroots organization and services that are provided so that in turn, we can let our members know about that. And one of the ways that we inform our members of services is we have something called the Community Connections Helpline. And you don't have to be in Wellcare to access this service. You can literally call this number and say, I live in 40210, I live in 40216, I'm having trouble with my rent, or I don't know how I'm going to pay for groceries this month. I don't know how I'm going to get school supplies or a job interview clothing. And so what we can do is by helping reduce that barrier of that immediate access, that money then can then be used towards healthcare that family might need. So by reducing, barriers to access to certain items, they can call this number that you can see here on the screen, and they can access any kind of service that they need. And again, this is open to the entire community. Yes, I work at Wellcare, of course, but, our role is to help the entire community. And one of the ways that we do that is we have a lot of partnerships and grants with communities. So what we try to do is come in and help provide resources to different community organizations. So for example, there was an organization in Eastern Kentucky where, they saw that healthcare costs were going up because so many members had diabetes, high A1C levels, asthma levels, but for whatever reason, clients were not improving. So when we dug a little deeper, we found out that the barrier was clients weren't physically going to preventative care classes. So we were able to come in with just a little bit of money and reduce the barrier of transportation by providing gift cards. So that's a very small example of a solution to helping a problem. Because what's the problem? Healthcare costs are going up and our clients are getting sicker and sicker and they're not taking care of themselves. And when we drill down and just simply talk to the agency, we found out that was the problem. So we were able to come in and help for a little bit. And the beauty in all of this is that we got to look at our clients before and after this intervention, and we saw that A1C levels went down. We had these amazing stories of people that were like, I literally couldn't walk up the stairs, and now I could walk my baby girl down the aisle. Like, that's all we need. Like, we know we're impacting our community. And, working here in Jefferson County, I'm doing the same thing in terms of partnering with folks like Jelani to learn about the services he has, in different churches and different organizations to see how can we help. And, to be honest, help isn't just monetary. Sometimes it's just showing up. So, a lot of our churches and different organizations with COVID, they've had to go to limited staff and they're just tapped out. So another way that we're partnering is I literally show up at churches and say, hey, do you need help? And once I hear that they do, we just physically come in and just help volunteer for just a little bit. that shores up that community organization. They're not as tapped, and more importantly, we're helping the community. So our partnerships can look various different ways, and we really try our best to be creative and see what's going on in particular parts of the state. The needs here in Louisville obviously are very different from the needs in Northern Kentucky or Bowling Green. So we really work specifically to see what's going on in our area. How can we partner creatively to make something happen? And again, partnerships are not necessarily just financial. Sometimes it's just showing up and, showing a community organization that you care and, learning more about them. And we do a lot of things like day of service where our staff physically go out. It's been a little limited because of COVID, but we literally go out to different organizations and just help volunteer. And the best way to do, and the wonderful thing about doing that is we learn about these organizations and we learn about the amazing work that they're doing. And then we can go back and say, hey, look, I learned about this organization. Maybe we can help them in this way. We do things like, back to school fairs where we partner with like local police officers, to help and just provide that service. So we just try to do all that we can to embed ourselves into the community, to learn about the gaps and barriers that our clients and our community as a whole are facing, and how can we help. And again, the help can be different ways, not just with the benefits that we have, like a nurse hotline and free meals and things like that, but more importantly, our department physically goes out and tries to do things like set up breast cancer screenings or HIV screenings and different things like that to bring that to folks in the community so they don't have that barrier. And if we can at least help with that, hopefully in time, that can improve their healthcare behaviors and their overall physical well-being and things like that.
Yeah. So, so thank you. So you gave us a lot of information. So I appreciate it.
I get excited.
That was good. It's good. But you hit on some pretty important things, especially the discussion around social determinants of health, and how so much about our lives and our quality of lives and our health is affected by things that we may have limited control over. Right? So while some are asking that a lot of systems change or that we get access to this or that the healthcare systems change, in the meantime, it's so critically important that people like you and some of the work you're doing is there, because there are big gaps to be filled, and you're helping to fill them. Because as it stands right now, it doesn't look like a lot of people are. It doesn't look like there are some things that may seem a little bit more intractable right now, and so individuals and communities, we have to work on this ourselves, and the work you're doing is so important for that. So I personally appreciate it.
Well, thank you. We try our best to, like I say, just get in there. And best way to learn is just to be out into the community and learn what's going on. And if we can provide that help, then that's what we're here for.
So if somebody wanted to learn more about your services and how to get connected to you, we put up the graphic about how to about the phone number to reach out. But
sure.
Some people like dealing with the internet. Some people like being on the phone and being able to reach out to you guys there. What ways can they get in contact with people?
Of course. So as you mentioned, the graphic that you put up, that's for anybody in the community that needs a resource. And I forgot to mention this too. So when you're linked to a resource, so we have some people called job coaches, and what they do is they help guide you through the process of resources and things like that. And so they'll call you back a week later just to make sure that service worked. So if we find out that we referred you somewhere and we didn't know that their hours changed because of COVID, or they don't have as much in their food pantry anymore, that guides me then to go, okay, I need to come up with something else for this zip code in Louisville or this zip code in Harlan County. So we're always on the pulse of that to find out. That's why we try to be so embedded in the community, to learn about different resources so that we can update our systems, so in turn our clients get that information. And then secondarily, if just reaching out to the audience here, if you're a community-based organization and you might need assistance with maybe putting on a health fair. You want us to just kind of learn about the resources that you have. You might just want to have a conversation with one of us about how can we, partner and do things like that. You're more than welcome to contact me. My name is Sameera Jackson, and it's Sameera.Jackson@wellcare.com. You can easily email me if you've got questions about partnership opportunities or opportunities that you think might be helpful for us to be in the community. We're doing all that we can. I mean, I'd love to be everywhere, but there's only one of me. But, there's a lot of things that we're passionate about, such as food access. We all know that sadly, there are neighborhoods in this county that have different food access, and that's just not fair. Let's be honest. The Kroger I go to is very different than the Kroger in the West End that I used to go to when I worked there. And that's not fair, because that, of course, is impacting everybody's health. If you don't have access to healthy foods, of course, your health is not going to be as great as it could be. So, we try to learn about all these different organizations so that we can partner with them and try to help bring healthy food access to our clients, and also inform our clients about these services, because sometimes folks don't know about that. We've done things in other communities like double dollars programs with farmers markets, so that, you basically can double the amount of food that you have with your, EBT card. So if you were going to use $10 towards your healthy food, you can actually get $20 worth of food. So we do have partnerships and things like that. So, we're just trying to do all that we can to help as best we can. So once again, if you have, an organization that you're working for, or you have a particular interest in, some of these health behaviors, by all means, contact me. Or if you just simply want some resources, you can call that 1-866 number that Jelani posted earlier. Oh, and then one thing I definitely wanted to tell everybody about is we have a grant opportunity called Wellcare Health Champions. And essentially, you can nominate anybody in your community that you feel like is a community hero. So this person, does advocacy, volunteerism, anybody. It could be through your church, through the organization that you work for, that's a really good steward in your community and really trying to help. And we'll get you the information on that also. So we're giving away grant opportunities, $3,000 grants here in Jefferson County. And the overall winner will receive $5,000. So please, if you have anybody that you feel like, embodies advocacy, volunteerism, and service, by all means, nominate them for this grant opportunity.
Absolutely. Look, y'all need to go out there and y'all need to get that money.
And especially with, so many of our nonprofits and churches, that obviously COVID impacted, funding was impacted. So by all means, and then also just highlight the good work that so many folks are doing behind the scenes that, people forget about. So please, please, please nominate some folks.
Okay. Yes, please do. Absolutely. And we can we can talk a little bit more about this. About can you tell us a little bit more about what are some of the qualities of the people you're looking for, and who should be nominated? Like, what
Sure.
are the?
Of course. So we're looking for, nominations for individuals that, are those tireless champions for the unspoken for and the unheard for. Everybody has somebody in their church that has literally volunteered for 40 years. Those are the folks we're looking for, along with somebody that, started a new organization and they might just need some assistance, somebody that's doing something innovative. So to answer your question, it's honestly whoever you feel like is a community hero to you. So that could be somebody in your church. That could be somebody that you know about that's starting a new organization. There's a lot of people that are working very hard on food access. I know that there's some new organizations popping up in town that are specifically addressing maternal health issues within the African American community. So it's whomever you think of that you want to highlight. You want them to get, access to some resources that they so desperately need, and also just to highlight the great work that they're doing. So, it's somebody that's, dedicated, somebody that's motivated, somebody that's done some initiatives, somebody that's maybe starting something from the ground up. So it's whomever you want to highlight that you feel like needs to be heralded, so to speak, as a community champion.
All right. Well, thank you for letting us know about that, and thank you so much for your time today. We appreciate it. Remember, go out and email Sameera. Go to the websites. Go to the go nominate the people you know who you think would be good for the champion community health champions grant. This thing is wide open, and
Yes,
so I'm glad you guys are doing this, and I'm glad you were able to join us today.
of course. Thank you all so much. Have a great day, everyone.
All right, have a great one.